All right, we are rolling. Good afternoon, morning, evening, wherever you are. Welcome to the GBNO show, the Get Better Not Older show. I am Dr. Rob Jones. This is my awesome wife, Shannon, the dietitian.
Hi.
How's it going, everybody? So, why are you tuning into us? We have a combined over half century of clinical experience. Shannon from the inside out, and yours truly from the outside in. We're covering all the bases on health. I'm your musculoskeletal guy. She's the cell girl. So today's topic, why don't you tell everybody?
Well, we're going to be talking about blood pressure. It is one of the most Googled topics, which is not surprising to me because 2 of 3 Americans have elevated blood pressure.
I didn't realize it was that high.
Yeah.
The thing, too, is if you look at the way it's been managed, we are seeing tons of new data on how it's kind of not being managed properly, and it's not a major issue if it's managed the right way.
Well, and there are, let's just say, there are a lot of variables when it comes to blood pressure. What we're presenting today is probably 2 things that people have never heard of, and it's literally foundational. When we start to talk about blood pressure, this is the very beginnings of we're talking the issues with control. So I want to bring this up at the very beginning that this is not comprehensive. Right. We understand that there are genetic predispositions and that there are many, many, many more variables when it comes to controlling your blood pressure. Simply what we are doing today is focusing on 2 areas, probably of newer research to people that is extremely enlightening. And it really, this is not anything you're going to hear from your medical doctor. Okay. There are plenty medical doctors that do functional medicine that are very in tune to this information, but it's not something that you're going to hear when you go to your PCP and have a high blood pressure reading.
Okay, time out. What's a PCP?
Primary care physician.
What is a functional medicine doctor?
Functional medicine doctor is an MD trained, but they also are trained in integrative or functional medicine.
Which does what?
Basically, they don't say, wow, your blood pressure is elevated and it's been elevated the last 3 times you've been in my office. I'm going to start you on a blood pressure medicine. What they do is they say, your blood pressure's been elevated the last 3 times you've been in my office. Let's look into what your body's trying to tell us and figure out why the origination of this blood pressure issue for you.
So just like what I do when people come in with back pain or shoulder pain or whatever, we don't just treat at the site of injury or the site of pain. We look deeper for foundational issues because
Correct.
Like everything else, if your blood pressure is elevated, there's something going on that needs to be addressed deep down in the layers versus just taking a pill going, hey, this is going to knock it down.
And did you know that 50% of people with blood pressure don't even respond to medication anyway?
Yeah, see, I didn't know that. We were talking about when we were kind of going over podcast stuff last night. You brought up that stat. I wasn't aware of that because this is not my world.
And did you know that even if you are put on a medication for blood pressure, so your blood pressure is measured in millimeters of mercury, and did you know that it doesn't matter what medication you're on, it only has the ability of lowering your level at best 6 millimeters of mercury?
Okay, so explain that.
So ideally, your blood pressure would be what?
120 over 80 is kind of the ideal.
Standard,
pretty good. But if you're at 123 over 84, there's some variability on how you got to the office that day to get your blood pressure checked. Were you in stressful traffic, or did you take it in the morning after a bad dream and your adrenaline?
Or you have white coat syndrome.
Or you have white coat syndrome. So there's some that's why they give you a little bit of leeway. Yeah, I've even had some doctors tell me when mine used to be a little high, yeah, you're 127, 128 over 91, 88. It's not that bad.
But I want to point out, however, for every millimeter that your blood pressure is over that ideal level, you increase your risk of cardiovascular disease by 1%.
Right. So if your ideal BP, blood pressure, is 120 over 80, and you go into the office and your blood pressure is now 130 over 80, you have increased your risk of something severe happening by about how much?
10%.
10%.
And then let's say you're lower, it's diastolic and systolic. Let's say both are elevated. You have to add up the levels of mercury, the millimeters of mercury for both of them to get that total percentage. But that's significant. Then if you think about the statistic that at best medication is only lowering it 6 millimeters of mercury,
you're still elevated potentially.
Exactly.
X
And
percentage.
what are the side effects from these medications?
Right.
And what are they creating? So today, what we are talking about are two areas that truly are the cart before the horse. I'm talking decades of knowing, when we start to pay attention to this, we are talking about being aware of something that would not manifest in high blood pressure until decades later. This is really kind of the foundational or infancy level to blood pressure or vascular disease of any sort, really.
Can we put up that image we were talking about earlier about how it looks in a vessel? Because I'm an anatomy dork, can I explain this?
Yes.
Okay, so
Dork out.
for people who are watching YouTube, you're going to see this. For if you're listening to this in the car or something, you're not going to be able to see it clearly, but I'll understand it. The image on the left is a pretty good-looking blood vessel that is constricted. Okay, you can see those little round things floating around. Those are called red blood cells. They have hemoglobin on them. They are what carry oxygen to your tissues, but they also, when they coalesce together or stick together, they cause clotting. So if you have a cut, that's what sticks together. Now, you can see the inside lining of that blood vessel is called the tunica intima, and it's basically made up of these little cells, and they look nice and slippery right now. That is a constricted blood vessel, meaning when your heart pumps and it contracts, it's smooth. So there's two different types of muscle. There's skeletal muscle, which is the muscle that you're looking at. You're looking at me like, dude, don't go down this path.
We don't have time.
We do.
We don't.
This is important.
They don't care.
This is important.
They don't care.
Shush.
Stay on script.
So when you contract your muscle and you look at your bicep, that's skeletal muscle. The muscle that you're seeing in the arterial wall and in the heart is called smooth muscle. You can't control it. It does its own thing. Your nervous system takes care of it. So in the image on the left, your smooth muscle is contracting to push the blood through the system so it can get to the distal areas or the furthest away areas in your body. That's a normal constriction. We need that. Every time the heart pumps, the arteries constrict, push it through so you can get what's called perfusion to all the end ranges of your body. Now, the picture on the right is dilation, where you can see the muscles are now relaxed and you've got this big opening of what we call the lumen or the center or the tube, and you've got more red blood cells coming through.
These are vessels.
Yeah, so these are your arteries, basically. Veins are different. They don't contract and relax. They are pumped by your muscle action. That's a whole different mechanism. These are arteries. These are what take artery. This is how we remember it in school. Artery starts with the word A. The word away artery starts with the letter A, and away starts with the letter A. So your arteries take blood away from the heart. So it constricts and then it dilates. So the picture on the right is a nice big opening where all those red blood cells are coming through. Now, high blood pressure is when, or even moderate blood pressure, that is elevated a little bit, is when you spend more time in a constricted state, like the picture on the left. And if you look at the picture on the left, it doesn't have as many red blood cells coming through because it's constricted. Now, if you look at the picture on the right, there's a lot more going through because it's just nice and open and passable. If you spend a lot of time in that constricted state, the system works harder. You get irritation on the inside lining. It's no longer nice and lubed up and slippery. It becomes a little bit more sticky because of inflammation and everything else. That's when things start to collect on the wall. That's when things harden. That's when we get into atherosclerosis. That's when we get into blood clotting. That's when we get into...
We're talking about hypertension.
I know, but why does hypertension or blood pressure translate into the sequelae or the next bad thing happening? That next bad thing happening is because things are sticking to the inside of that wall. And what's the number one risk factor for prolonged hypertension? Do you know?
Staying constricted.
Well, but the number one sequelae is not just a heart attack, it's a stroke. That's the number one problem that we really worry about with people with chronic high blood pressure. Because when the vessel is constricted, you basically get these little clots that form over time because the walls are hardening. And then over time, one of those clots can break loose. Now you can have a stroke or you can have a pulmonary embolism. But that's the real true acute danger of hypertension or high blood pressure.
Correct.
Okay, sorry.
Okay, so now we just added 10 minutes, and we're going to go over.
But it was a really interesting, very interesting, Eric. Well, that was interesting, wasn't it? Okay, so now people should have a visual of a constricted vessel versus a nice dilated vessel.
Okay, and we only have a finite amount of vessels, and only so much blood perfuses said vessels on every day. So what we're talking about is constriction today, and what causes constriction, and then we're going to talk to everybody about what they can do to not have that happen and live a life that pays more attention to the very infancy of what's causing high blood pressure, which is blood vessel constriction. Okay, so the very first thing we're going to talk about, this is like the very beginnings of blood vessel constriction. And remember, this is applicable to all vessel diseases, which are, guess what? All diseases. Every single organ in our body is perfused by blood and has vessels. Therefore, this isn't just for hypertension, but that's what we're focusing on today.
You're just trying to really keep me on topic, aren't you?
I am. So 2 of 3 Americans suffer. We already talked about that.
Yep.
And so there are 2 culprits that we're talking about today, nitric oxide and uric acid. My guess is nobody's ever heard of this before as it relates to hypertension. Anyway, so when you produce nitric oxide, it dilates your vessels. So that means it's kind of the holy grail to all vessel disease. If you don't have nitric oxide, then you don't have the ability to dilate your vessels.
Right. So again, put it in lay terms. So nitric oxide is a little chemical that's released from many places, but for what we're talking about now, it's released from the endothelial cells or the cells lining the artery. And when it's released in a normal state, it creates dilation or an opening.
Exactly.
Picture blowing a spitball through a skinny little straw versus a big old fat McDonald's straw. Okay. That spitball is going to go much more easily through the McDonald's straw because it's dilated or bigger. That's really what nitric oxide does, is it makes the lumen or the opening bigger.
It precedes truly everything. Like it is very foundational. That's really important to note because we're talking decades before you might even have issues with your blood pressure or know that you have issues. This is really preventative we're talking today. Okay, so let's get into a little bit about nitric oxide. When you lose the ability to make nitric oxide, you set the stage for vascular disease. And so let's talk about what happens. There's 4 common denominators with vascular disease. Do you know what they are?
Common denominators as far as what causes them?
Yeah.
Well, sure.
First and foremost is what? Decreased blood flow, ischemia, Okay, so that's kind of what you were talking about, where the vessel is occluded, where we're stopping blood flow to a certain area. That is going to cause disease.
Yep.
The next one is inflammation. Okay, the next one is oxidative stress, which we've talked a lot about here, and then the other is immune dysfunction, which we also have talked a lot about. Interesting enough, nitric oxide has 4 main jobs, if you will. Dilates the blood vessels, it decreases inflammation, it gets rid of oxidative stress, or prevents it, I guess is better, and then it also prevents immune dysfunction. So that is how foundational nitric oxide is. So there are some things that we are doing without knowing that are preventing nitric oxide from even originating, and that starts in our mouth. And this, there is a researcher, Dr. Nathan Bryan, who really has done the majority of this research on this area. But they have actually identified the exact bacteria in our mouth that allows for nitric oxide to be released. So remember how we've always talked about microbiome in our gut? Well, we have a microbiome in our mouth too.
So explain microbiome to people who are just maybe tuning in for the first time. They don't know what a microbiome is.
Microbiome, we are full of trillions of bacteria.
Good bacteria.
Good bacteria. And so there's always a need to have good, homeostasis is that you have a good level of good and that we have a low level of bad. And we're now correlating microbiome to almost all diseases. So this is just one more area where we are learning that some things that we have been doing historically are actually preventing nitric oxide from being released in our mouth because we're using mouthwash. So you know how they advertise mouthwash? It kills 99.9% of bacteria. Unfortunately, it's not selective.
Yeah.
And that is absolutely damaging and getting rid of 99.9% of the bacteria in your mouth, which is the actual bacteria that your body needs to produce nitric oxide.
Right. So our habits of maybe being super clean and that fresh feeling in your mouth because your whatever green crazy mouthwash, that's portions of it are alcohol, which we know we use alcohol to swab our skin before we give an injection, right? That's what it's doing inside.
Full of dyes.
It's full of dyes, but what's the alcohol for? It's Purell like that you're putting on your hands, right? You're putting that tastes pretty good in your mouth, and you're basically killing all the stuff that you need to release or stimulate nitric oxide release so you can dilate your vessels.
Vessels throughout your entire body for every single organ.
Yet again.
Including your brain.
Yeah. So yet again, mass production of food, mass production of chemicals, mass production of health and beauty products are basically killing us.
The other thing that is, and this kind of has rocked the dental world, but there are definitely some integrative and functional dentistry that is jumping on board with this, is fluoride in toothpaste.
Yep.
And, we have not been using fluoride in our toothpaste for a while because I have known this for a while.
Yeah, you changed me up about 6 months ago.
Yeah.
And on a side note, I used to use that kind of sensitivity stuff because as you get over 50, your teeth get sensitive to cold and everything else. We went back to, what's the brand we use again?
Hello.
So if you're wanting good toothpaste, we're not affiliated with them. Hello. I think you just get it on Amazon or something, right? It's really good. My sensitivity went away.
And here's the other thing that happened. I used to have, when I would go to the dentist every 6 months, they always want to do a fluoride treatment at the end, and then you're using fluoride toothpaste. And I would always have a fair amount of tartar just in the areas that I obviously was missing. Since that I've stopped using fluoride toothpaste,
No more tartar.
they are like, you have zero tartar.
Yeah.
Do you want to know what the good bacteria feed off of in our mouth?
Let me guess. Tartar?
It's the sugar and
it's the stuff.
Yeah,
but
that's what keeps them healthy.
Yeah.
It's all meant to be that way.
You still need to brush your teeth to have good healthy gums and to make sure you don't end up with gum disease and your teeth are falling out of your head. You know what I mean? But again, it just goes to show your body needs essential bacteria for gazillions of functions. And if we wipe it out, we wipe out our health.
So here is one other thing. So let's say hypothetically someone listening to this says, well, I don't use mouthwash and I've never used fluoride in my toothpaste. The next biggest culprit to issues with nitric oxide is with the use of acid reducers. Mm-hmm. So most notably the proton pump inhibitors, because the proton pump has...
Hold on. Before you get into that, Prevacid, Nexium...
I was getting ready to explain.
Sorry. I'm ahead.
Proton pumps in your stomach are what release acid, and there are 3 different pumps that release acid. When you use something like a Zantac or an H2 blocker, that's only blocking one of 3 pumps. So you still have acid that is being produced. But when these proton pumps were created, it was to shut down the entire pump, all 3 levels of acid, to really shut down all acid production. Mm-hmm. And those are in the name brands of Prevacid, Nexium. Omeprazole is Prilosec is the big one over the counter. It's really concerning that these now are over the counter because they were never meant to be long-term medications. They were meant to be a 14-day get rid of your reflux, or let's say you have an ulcer or something. It was not meant to be a chronically used medication, which it definitely is. People are using it daily to mitigate
for years and
reflux and GERD.
Yeah. GERD meaning what?
Gastroesophageal reflux disease.
Right, which can actually literally burn the esophagus, and that's what causes heartburn and pain. But they were originally created to shut down the mechanisms you just talked about so the esophagus could heal, basically, right? But the problem now is people are taking it chronically because it works for their heartburn. But guess what? You need acidity in your stomach to break down your food. If you don't have said acidity, your food is not going to break down and you're not going to absorb as much. Now we're getting into this whole world of lack of nutrient and mineral and vitamin uptake into the body.
And we know, and we're not going to really get into this today. Again, hypertension there's a lot of variables involved, but we know proton pump inhibitors are terrible for magnesium and vitamin D, and those are precursors. So
can I interject for 1 second?
Yes.
Because I have a personal story with hypertension. I'm going to be 53 next week, and I was diagnosed with hypertension, not crazy levels, but regularly 135 over 90 in my 20s. And it's been like that the majority of my adult life until about a year ago when you recommended that I start taking magnesium on the regular. I used to do magnesium in like my electrolytes before workouts and in the morning, that sort of thing. But you got me into Magnesium Breakthrough about a year ago. And interestingly, I don't check my blood pressure almost ever, but I was visiting my parents up in Canada, and, they're in their 80s, and they, like all old people, have a little blood pressure cuff sitting right beside
on the breakfast table.
Yeah, well, it's actually in the dining room, but I saw it one day and I was having my morning tea and I was like, I'm going to check my blood pressure. I was there for 5 days. I checked it every morning and every night, and it was always 123 over 81, 122 over 82 or 81. And I've not done anything different other than just magnesium before I go to bed every night.
But you used to also have reflux.
I did, but I've really fixed that with, listen to a previous podcast on fasting. I try not to eat after 7:30, 8 o'clock now, and I used to eat pretty late into the night because I was just hungry. Yeah. But anyways, the point being with the magnesium that you just mentioned, magnesium, it has a gazillion different functions, but for what we're talking about now, muscles are magnesium is a muscle relaxant. Okay, it's a very important agent to help muscles, skeletal muscle like we talked about, biceps, quadriceps, whatever, but also smooth muscle like the inside of arteries. It helps them relax. So it's the only variable I changed. And my blood pressure went back down to normal. So if you think of a tight constricted blood vessel that won't relax, there's a lot of data now that shows you need to increase your magnesium because the magnesium is stimulating a relaxing effect. And the whole thing about cut down your salt, it's not a culprit of salt.
Well, we're not going to really get into that today because that's a whole, like I said, there's so many variables to this. We're going to stay focused on the nitric oxide.
Are you trying to say I can't focus?
Possibly. So going on, so we've mentioned, so it's the proton pump inhibitors that are also causing issue with nutrients such as magnesium and vitamin D, which do have something to do with issues with blood pressure as well.
Vitamin D plays a small role, again, in relaxation of the arterial wall. So
there you go.
There you go. I didn't go on a long diatribe on that. Do you notice that?
So here, this said, I'm
see how she
ignoring
just, see how she
him?
just ignores me? She skates right over it because she's so used to it.
Focus.
Yeah.
Okay. So Dr. Nathan Bryan published a study in 2019. I geek out to stuff like this. He had the study participants were on the same diet, same exercise, very controlled. And for 7 days, he gave the participant that did not have hypertension mouthwash. The mouthwash induced high blood pressure.
In 7 days?
In 7 days.
Wow.
Then he took the mouthwash away for 4, and it completely corrected.
Unbelievable.
So that is Dr. Nathan Bryan. It was published in 2019. I don't know what journal, but you can Google's that.
This broadcast is not brought to you by Scope.
Exactly. We're going to have them after us. Okay, so then we start to talk about uric acid, which is another culprit.
Yeah.
And
before you start, uric acid typically associated with what disorder?
Gout.
Gout, okay, which we were all taught in school decades ago that gout was the disorder of overindulgence, high purines from steak and rich cheeses and fatty meats and wine.
Alcohol.
And now we know it is a result of...
There is no doubt that high purine foods can be an issue for some people that do create elevated uric acid. You can't eliminate that completely. However, it's not to the degree
that we were taught.
Across the board, it's not the end-all, be-all.
Yeah.
Okay? So newer data is connecting it to fructose. Fructose is the natural sugar that is in all fruit.
Right.
It ends in an OSE, so that's always a sugar. But this is not the fructose we're talking about.
Yeah. So we're not saying don't eat apples, don't eat oranges, don't eat bananas. That's fine. If you're eating your fructose in fruit form, keep eating it because it's very important for health.
That definitely not the fructose we're talking about today. The fructose that we're talking about today is high fructose corn syrup.
Yes.
Which in the inception of all processed foods has snuck its way into almost everything. You need to assume that anything that is processed, anything more than one ingredient, unless you absolutely have vetted that product, it probably has some high fructose corn syrup in it. Why? Because it increases the shelf life. Because it improves the browning point. It does all kinds of things to process so that it lasts longer on the shelf. It makes production time less. It was all about how much can we produce in the least amount of time and stays the freshest the longest.
Yeah, but it also makes things hyper palatable, right?
Yeah.
Nice and sweet and yum yum.
It's why we like it, right?
Triggers something in the brain that makes you want to go, ooh, more sugar, please.
So unfortunately, this synthetic fructose triggers the metabolic pathway that creates uric acid.
Yeah.
And that's via the liver. And ironically, an elevated uric acid does what to nitric oxide?
it blunts it.
Exactly.
And if you look at uric acid crystals under a microscope, they're miniature microscopic little daggers.
Yeah.
So they're highly inflammatory. So as they're rocking and rolling through a constricted lumen or through a constricted blood vessel, they're knocking around the sides of the blood vessel. They're causing little cuts and scratches, where those little indentation points is where accumulation can take place of platelets, red blood cells, bits of fat, calcification, further inflammation. They're just basically, picture you taking that straw and then jamming a bunch of little knives in that straw and blowing those knives through. The inside of the straw is going to be all scraped up,
which creates divots and an injury that then said plaques adhere to.
Exactly.
So it really is the precursor. Uric acid is a precursor to not only high blood pressure, but we're talking insulin resistance and weight gain and metabolic syndrome, which are all the big hitters as far as cardiovascular disease, diabetes, hypertension altogether.
Yep.
So this isn't just, again, it's all vascular, right? And so here we are with this nitric oxide that is, so important for vessels to dilate. And then we have jacked our food supply with an ingredient that is creating high uric acid levels that are now suppressing nitric oxide. And we wonder why we are suffering from so many diseases. So, it's interesting when you and I were talking about this last night, you're like, God, it's just like if people would just eat real whole food and stay away from everything that's being marketed.
Yeah.
There I am again.
Yeah.
Look at how much disease is being created as a result of the crap that is in our food. And we've all
100%.
known this. The body is miraculous, truly. I mean, just think about how this is all so connected. It starts with the bacteria in our mouth, and who would have thought those little guys were so important to every vascular disease we have, right? Yeah. So I think, as we advance and as we understand our microbiome better, we are now understanding more of what we talk about, functional, integrative, foundational health, meaning let's back up and do things right from the very beginning,
right,
so that down the lane here, we're not just kicking the can, we're actually addressing it from the very beginning.
So I always recommend to my patients, not saying don't go to your medical doctor at all, but I'm saying if you go to your medical doctor and you say, man, I've got reflux, and they say, oh, you just need to go on this medication for reflux, Prevacid or Nexium or whatever, I always say you probably should see somebody in addition to your doctor to look at why you're having reflux.
Yeah, they don't even ask lifestyle questions to begin with. And then, some people just are lacking digestive enzymes.
Yeah.
If they start taking some digestive enzymes, then all of a sudden their reflux is mitigated.
100%.
Or maybe they are having like a high histamine response to certain foods that are causing it. There are a plethora of areas where there is a reason. Your body is trying to tell you. It is giving you a symptom.
Yeah.
That symptom is not meant to have a Band-Aid on it.
Right.
It's meant to say, hey, dude, we're not headed in the right direction here. Something's wrong. Let's look into it.
Right. Absolutely.
And that's really what we're enlightening people on.
100%. So I think with what's happening with the administration change, and hopefully we're going to see some feet being held to the fire on what is being allowed in our food system.
Well, we have to wonder, why is it allowed here and it's not allowed in other countries?
So, all right, let's take a break in the podcast. Let's get some questions in for rapid fire. You want to go first? Yeah.
Hey, Dr. Rob, what shoes do you recommend for plantar fasciitis?
Good question. I highly recommend, number one, staying out of super cushiony shoes. We have been in this game for the last 5 to 8 to 10 years of the more cushion, the better. Hokas and some of these other shoes that are like walking in a Kleenex box. The problem with that, I
got a visual on that.
I know. Well, that's from my friend Lisa back in Lawrence. She said that's what a pair of shoes were like. I love that analogy. But the more cushion you have, the less contact you have with the ground. We're monkeys. We're designed to hit the ground, spread our toes, and use the muscles on the bottom of the foot to basically support and feel the ground. So when we wear these big cushion shoes, we can't feel it. Balance goes off. Proprioception, which is reaction to ground, goes off. And then shoes that are super narrow. The reason women sometimes have these crazy bunions where their big toe is sticking out that way is because their feet were crammed in these little toe boxes. So you've got to get out of those. Now, if you're a runner, wear some Hokas or whatever because you need the cushion. But if you're walking around, I want you to get a shoe that has zero drop, meaning there's no lift in the back. The level of the heel and the toes are the same. That's number one. Number two is a wide toe box. So you literally could put on toe spreaders and put your feet in the shoe and still be comfortable. You don't want your feet crammed in together like a normal shoe. So my number one recommendation is, and this is not because I work with them, they're great, Paluvas. So if you just go to wearpaluva.com, or maybe it's Wear Paluva on Instagram, and I think it's just Paluva, PELUVA.com, created by Mark Sisson, who is the founder of Primal Kitchen. Great products, but Paluvas are amazing because they fit your toes individually. They just sent me a few new pairs. They're really cool. They have enough cushioning, so it's not like the Vibram or Vibram 5-finger shoes that came out 10 years ago. These actually have cushioning so you can actually walk trails and walk concrete comfortably. So those are the number one. Patients all the time will say, what shoes should I get? I would say if you have plantar fasciitis, get Paluvas or something else wide-based. Don't get the cushioning. Don't get arch supports. That's the worst thing you can do.
Okay.
Okay, your turn. I talk too much, don't I?
No.
Wow, I can't believe she just said that.
I'm trying to get you to shut up.
Yeah. Shannon, what is the difference between a prebiotic and probiotic? It's a good question.
Well, so this is a good question only because we talk a lot about microbiome. Mm-hmm. And I think, the supplement industry clearly is a huge one, and there's a lot on the market. But you don't really need supplements if you're eating properly. Prebiotics are basically fiber. So it's the food that feeds your bacteria. And your microbiome is trillions of bacteria, good bacteria that live in our GI tract. And anything with fiber is going to feed that. They have to eat something or they die off, and giving your body fiber, so think plant foods of any kind, are going to give the bacteria something to munch on, something to flourish and eat. Probiotics themselves are actually strains of bacteria. Lactobacillus is, a common one. So
when you take a probiotic pill, that is you're literally eating the good bacteria.
Yeah, and it's really important to buy a good brand because, one, the supplement industry is not regulated, and there are a lot that are being produced in a way that do not allow the bacteria to arrive alive. I mean, they've got to be alive to be able to do what they're in. So it has to be packaged properly. It has to be, some require refrigeration, some don't. But that third party testing is really important, where the company, look for a seal that, basically says that we've sent our product off to a third party company that has determined that what we say is in here is actually in here. So that's really important, just to make sure that it's doing some good. But you can also eat foods that have these bacteria in them, like yogurt and kefir and, what are some other ones?
Kimchi.
Mm-hmm. Yep, those are good ones. Yep. And even there are like some fortified cottage cheeses and yogurts now too that have, and you just, again, make sure they're made properly. Mm-hmm. But that's basically the difference. The difference is the prebiotics are the food for your bacteria, and the probiotic itself is the actual bacteria.
All right. Good answer. Short and concise, unlike mine. Now back to the podcast. Okay, so as far as, the medical system, I think what you're going to see is I'm hoping you'll see this, but instead of medical schools being an algorithm of Here's the symptom. Give a medicine for it. Medicine will hopefully become, because there's so much data on this now, this isn't woo-woo anymore. This is mainstream. This is the real researchers coming up with real information. So when somebody goes in to see their primary care practitioner, I'm really praying in the next couple of years that primary care practitioner goes, well, you've got high blood pressure. This is the third appointment in a row. Instead of let's put you on a what was that main one you said the other night?
Well, there's about 5 different
calcium
classes.
channel blocker
Exactly.
or whatever else it is that only will bring it down 5 points or whatever, right? They'll go, how's your magnesium intake? Are you using a fluoridated toothpaste? Are you using mouthwash? Let's cut those two out and let's increase vitamin D and magnesium. That's really my hope for the medical future. I don't know if it'll happen, but it seems so much easier to me.
But how about we take high fructose corn syrup completely out of all food?
Well, 100%. I mean, that's, and again,
it's
that's
not a necessary for nutrition at all. And we now know that, let's say you're not using a mouthwash and you're not using a fluorinated toothpaste and you're not using a PPI or an acid reducer, yet you are eating a diet full of high fructose corn syrup.
So
then you're blunting nitric oxide because of the elevated uric acid anyway. So let's talk about...
So that should be the next question. But okay, yes.
Let's talk about ways to decrease both the issues with nitric oxide and also the fructose.
Do you notice how she pulls me right back in direction?
So first is... stop using mouthwash.
You're trying to roll your eyes at me
the
right now. I know
second thing is change your toothpaste.
Yes.
And we mentioned a brand, but there's numerous. You just need to do fluoride free. The next thing is you're going to stop using any type of acid reducer. If you're having acid issues, you are going to look in to see what part of your lifestyle may be causing that.
So 3 quick tips. Stop eating after 7 or 7:30. If you are getting reflux after you eat, try drinking less while you're eating, because we need high acidity in the stomach. And if you don't have high acidity in the stomach to break down food, and you're drinking, you know, when you go to a restaurant, they give you water, right? You start sipping water right away.
Or they're drinking Cokes.
Yeah, right. Okay. So you're drinking, the first thing they do, they're drinking before you even get your food. Well, you are diluting, you're putting water on a fire, basically. You need your stomach acid really acidic to break down your food.
And then let's say, hypothetically, your issue is that you are overproducing or underproducing acid. There are ways to mitigate that do not require medication. Like I said, sometimes it's simply that you just need help breaking down. Sometimes your digestive enzymes become latent and not as proficient, and you just need a little help in that area.
Latent meaning asleep.
That's right. So sometimes when you've not used them for a while, they just aren't as sharp as they once were, and they just need a little help. And again, that's just a supplement that can be taken. But the biggest takeaway here, too, is then you have to be aware of what you're putting in your body. And definitely, I would say, number one thing is just mitigate and stop taking in anything that has high fructose corn syrup in it or any type of synthetic fructose. Okay? So that's going to take some investigation, and it's going to take some time for you to stop and look at labels and be sure what you're putting in your body. But there's plenty of resources on the internet that can help with this. But that's the first thing: processed food and high fructose corn syrup. So if you get rid of the mouthwash and you change your toothpaste, you stop using acid reducers, then we have to address what you're putting in your body. So then I'll say this: you can increase stuff that has nitrates in it. So there are some nitrate-rich foods. Do you know what the number one is? Don't look at your paper.
Beets.
Yeah, you're pretty good. So you're noticing a lot of beet supplements, a lot of beet, you can see commercials for it.
It's not a lot of data to support the beet supplementation, though. eating beets, though.
Yes, and there are reasons for that, having to do with your microbiome again. So that just add beets to, if you enjoy them, add beets. That would be one good. Leafy greens, celery, carrots are all good nitrate-rich foods that you can add. You can increase antioxidants, which are going to just help scavenge any bad little cells that are, or bad free radicals that are being produced. So berries, green tea, veggies are all good for that. And then exercise, Dr. Rob.
Amazing. Exercise actually comes in play.
Did you know that physical activity increases nitric oxide?
Who knew?
Wow.
This is earth-shattering. How about the fact that if you want to eliminate, I don't know, $2 trillion off of the national debt and the gazillion billion dollars that we're spending on healthcare every year, exercise is the number one pill that should be being prescribed. Even they're talking about correcting cancer now with a certain type of with the best types of exercise for said person.
Did you know that, obviously obesity prevention and weight management is my love. But did you know that it's been proven that exercise is actually not good for weight loss? It's actually good for disease prevention. That's really what it is, the creme de la creme.
Not good for weight loss. I'm confused.
Yeah. So, you need to do it, obviously, but when we talk about burning calories through exercise, then you turn around and eat a peanut butter and jelly sandwich.
Oh, I see what you're saying.
You see what I mean? So
Okay.
it's really, it's what you put in your body matters most when it comes to, you've got to create a calorie deficit. I don't care what anybody says. And the exercise component of it is to prevent disease.
Right.
Truly. Now, here we've come full circle, where we've said nitric oxide is the main thing we need to open those lovely vessels up and let this blood flow perfuse through every bit of our body, every organ, and exercise actually produces more of it. Wow. By design.
By design. Here's an interesting thing. If you want to know if your blood vessels are actually opened and you're getting good perfusion, you're sweating. You look down at your hands. Like right now, I'm not warm, I'm not cold, but you can kind of see my veins because I'm a little veiny. But when I work out or when I'm hot, I'm going to get really veiny. And that's because distally or far away in my body, my hands and my legs, not my core. This is proximal. This is distal. When you're hot, your body's trying to pull blood away from your core to regulate your temperature. When you sweat, you're releasing heat. When you're moving, you're producing heat. When you're moving and you're exercising, you're producing heat and sweat, which is going to push everything away from the core. It's going to dilate the blood vessels. And when you look down at your hands and your veins are sticking out a little bit more, your hands are a little bit red, guess why they're red? You've got blood in your extremities. When your hands are blue, guess where the blood is not? Okay. You have deoxygenated blood and you're looking at your venous system. You're looking at your veins. So exercise to open up the blood vessels. Yeah. It's just.
And then here's one more, sunlight.
Yeah.
Sunlight produces nitric oxide. Not with sunscreen on. It means you have to actually absorb the sun rays. So again, that at least 20 minutes. I don't know. That's a whole nother podcast.
Yeah, I was going to say, it could be another podcast, but there are a lot of people now saying an uptick in skin cancer. And this is not a recommendation for anybody. This is just general discussion. I'm not trying to go against any skin doctor advice. Okay. No, I'm not pretending to be a dermatologist, but there's a lot of people out there that say, sun gives life. We are supposed to be out in the sun, and the dysregulation of skin and sun exposure may be what's actually causing skin cancer. And the fact that you're putting sunscreen on your body
and trapping
it, like there's very, very few, again, all the bullshit they're putting in everything that we're consuming and putting on our bodies. You get some Hawaiian Tropic, which smells great and we've all used. You put it on your body with all the carcinogens it has in it, and then it literally bakes into your skin. Okay, you're literally cooking. That's what gives you a tan. It's your skin cooking, and now you're absorbing that into your system. I don't know if it's causing sun cancer or skin cancer from the sun. I'm not a specialist there, but I will tell you, there's people that I know. Laird Hamilton, I don't know him personally, but he's a big wave surfer in Hawaii, never had skin cancer, has been in the sun his whole life, lived in Hawaii, has never worn sunscreen.
Yeah, and I think this is a slippery slope.
It is a slippery slope, but I'm really good at that.
Yeah.
But what we're saying is, don't go against your doctor's advice, but at least go outside and get 10, 15, 20 minutes of sun exposure without sunscreen. If you're going to the beach, maybe put some on, put some safe sunscreen on that doesn't have carcinogens in it. And it exists. You got to look for it.
Go to the Environmental Work Group website, and they have safe products on there.
But you need vitamin D levels for lots of different stuff. But for this purposes, vitamin D is a vaso. It helps nitric oxide, and it helps dilate or open up those vessels. And
it also, it's just all part of the circle of life, restores our microbiome. I mean, there's just so many,
we
good
could go,
qualities.
Yeah, we could talk for hours on that.
There are nitric oxide supplements. Dr. Nathan Bryan has them on his website. They're lozenges that if people are worried that they don't have enough nitric oxide, and it also helps to correct microbiome too. We'll put that in the show notes, but that is a supplement that people can take. You just got to make sure it's the right kind. There's, like you said, a lot of phony supplements out there that aren't actually correcting what it needs to. All right, that's it for today.
That was good.
Dr. Rob.
I learned a lot, Shannon.
Okay, so we have some takeaways, and next time we're going to talk about seed oils. All right, wrap up. Thanks for watching, everybody. I'm Dr. Rob. I'm the outside in guy. I'm Shannon Jones, and I'm the inside out.
And thank you for watching the GBNO show. We're here to get you better, not older. Until next time, thanks for listening.